Washington State Department of Social and Health Services, Developmental Disabilities Administration, DDA, how to apply and why. The Washington State Department of Social and Health Services, Developmental Disabilities Administration, or DDA for short, offers programs and services that support children and adults with developmental disabilities in just about every area of life. There are other agencies that provide services and benefits such as health care and financial assistance. However, this video will focus on how to apply for DDA services and why it's important. Here's Jeremy Norden-Paul to explain more.
Applying for services from DDA is a multi-step process. The first two steps are 1. Applying for DDA eligibility, and 2. Requesting services. DDA uses certain criteria to determine if a person is DDA eligible. Applying for DDA eligibility does not determine if a person is eligible to receive a specific service. That comes later. To request a DDA eligibility packet, visit DDA's website to fill out an online information and service request form, or call your nearest DDA office and ask for the DDA eligibility packet. After the completed packet is submitted, DDA reviews it and will contact you to talk about your application. When a decision is made, your eligibility worker sends a Planned Action Notice, or PAN, to let you know if you have been approved or denied eligibility DDA. If there's a denial, the letter explains how to appeal the decision. If approved, the next step is to request services by following instructions in the PAN, using the Service and Information Request web form, or calling your local DDA office. It helps if you can describe the kinds of support needed at home and in the community. Visit informingfamilies.org/DDA-services for information about specific services. What happens next depends on the type of service you request. Let's explain.
There are two main types of programs: Community First Choice, or CFC, and Home and Community-Based Services waivers. Community First Choice, or CFC, is a program for people with low income who need help with activities of daily living like bathing and dressing. One of the main services CFC is personal care to help you with tasks to meet your physical care needs. There are other services too, like assistive technology to help you more independent and support to learn new skills. Because it is an entitlement, anyone who is eligible for the service can receive it with no waiting list. If you request CFC, the next step will be a financial eligibility determination to see if you qualify for Medicaid, followed by a functional assessment to determine the type and level of support the state will pay for. Home and community-based services waivers, or waivers for short, have more service options than CFC, and children's family income is not counted towards being eligible. However, unlike CFC, waivers are not an entitlement. This means that even if you are eligible, you are not guaranteed a waiver if the state does not have enough money to approve you.
Many clients of DDA receive both CFC and waiver services. If you're denied a waiver due to lack of funding, ask about the CFC. Just keep in mind that the family income of minors is counted as part of income eligibility for CFC, unlike waivers. Even though enrollment for waivers is limited, it's important to ask for what you need so that DDA and lawmakers know the true need and can plan for future budgets. And when openings occur, you're already in the system and can reapply. If you decide to hold off on requesting a service, or if you request a waiver and are denied, you will be placed on DDA's No Paid Services Caseload, or NPS. For more information on DDA services, visit informingfamilies.org/DDA-services.